medical conditions in today's scenario are increasing by the day, and people are losing hair as well. Everybody wants a hair transplant even if they have diabetes.
In hair transplant, lot of slits are made, lot of sites are created in thousands.
True.
Thousands of grafts are extracted. In FUT, there is a long stitch mark. Some skin part may become black and dead if you are diabetic.
Ever wondered about hair transplant in medical conditions? Medical conditions like diabetes, hypertension, somebody who has had a heart attack and is now on blood thinners. There can be other medical conditions like deep vein thrombosis, allergy to certain things, alopecia areata. There could be condition like drinking problem or somebody who is a chain smoker. So the list is long. But have you ever considered how hair transplant can be done for them? Join us in today's discussion with Dr. Satya Saraswat. We'll be discussing today how we can have hair transplant in certain medical conditions like diabetes, hypertension, and previous heart attacks with blood thinners at present. Stay tuned for this discussion. So, sir, taking into view that the medical conditions in today's scenario are increasing by the day, and people are losing hair as well. Everybody wants a hair transplant even if they have diabetes, for example. So, how should we go about in a patient who has had diabetes?
Yeah, thank you for this. So this is extremely important. And as you have rightly said, the chronic medical problems are on the rise everywhere because of a lot of factors into which details of which we are not talking about here. But we are seeing a lot of patients coming to us for hair transplant with these medical problems. And surprisingly, we had a patient from US directly came without appointment and he just asked to get a hair transplant done the next day. But being very cautious and very oriented and focused about the safety aspect of hair transplant, he was around 65 years. When we started asking him about his medical problem, we found out that he had almost all the medical problems you could think of, and he said that it's a minor procedure.
Really?
Why do we need to be cautious about this? And then we explained it to him, and then we did not do his procedure. He had to unfortunately go back because he had uncontrolled diabetes, blood pressure. He had undergone a bypass surgery, was on blood thinners. Absolutely a no-no, or a procedure which has to be planned very meticulously. We refused to do his surgery on a instant kind of basis, and he had to go back. So it's very, very important that if anybody has a medical problem, before actually going for the procedure directly, disclose this in your preliminary consultations or the preliminary communications any patient is having with their doctors or the clinic.
Correct.
Now, say there are a lot of problems, and every medical problem needs a specific approach to optimize that medical condition. Everything has to be as normal as possible. Then only it can give good results after a hair transplant. So let us consider the problem we have discussed, diabetes first.
Diabetes, yes.
Diabetes mellitus, as you know, either there is a decreased production of insulin or there is decreased sensitivity to the insulin in the peripheral end organs, like wherever it works. If somebody has decreased production right from the beginning of their life, this is known as type 1 diabetes, and these are the patients who are on insulin to control the blood pressure, because the primary function of insulin is decreasing the blood sugar. So type 1 patients, in my personal opinion, should not undergo hair transplant unless they are extremely motivated, and then it has to be performed under guidance of a physician who is present in the OR. Type 2 diabetes, on the other hand, has slowly decreased production of insulin and increased peripheral resistance to the work of insulin. In these kind of patients, first of all, you should get your HbA1c, which is the glycosylated hemoglobin. What's the percentage of your hemoglobin which has blood sugar in it? It's glycosylated. Normally, it's around 5.7 or less. And if anybody has more than 7.5, that means they are into diabetes. Less than 7 is pre-diabetic. There may be some variation in the values there. If a person has HbA1c higher than 8, They should not undergo a hair transplant unless this is controlled. Why? Because we know that diabetes affects the immune function. Diabetes slows down the way in which our body fights with infection. And in hair transplant, lot of slits are made, lot of sites are created in thousands.
True.
Thousands of grafts are extracted by FUE, and in FUT there is a long stitch mark. So these are the potential areas from where the bacteria or the infection can go inside the body. So if your diabetes is not controlled, you have very high chances of getting an infection because the body is not fighting the infection or the potential bacteria or viruses in a proper way. So the first thing is to control the blood sugar, to control the HbA1c value and the blood sugar fasting PP. Then other danger of diabetes is that people with diabetes have a higher risk of getting coronary artery disease. They have they can have cardiac problem. Sometimes it can be silent also. So a long-standing diabetes can suddenly go into a cardiac problem or a heart attack, as we know, myocardial infarction. So again, we need to optimize and control this blood sugar level first to prevent infection and to have a proper healing of the donor site. Blood circulation in diabetes is again on the lower side. So if the blood circulation is low and a patient wants to have a very high density hair transplant, sometimes there can be some damage to the skin, damage or necrosis as we call it in the scientific terms. Some skin part may become black and dead if you are diabetic. So these are very, very important things. A physician or a clinic should ideally get all the detailed investigation, and then they should always take a feedback of a physician and take a clearance from them before actually planning a hair transplant. Your blood sugar should be under control. Procedure should be done under a good antibiotic coverage, and a good follow-up is also absolutely essential by the doctor and the team even after the hair transplant for at least 5 to 7 days till the healing and everything has completely happened.
So I think to sum up, for somebody who is a diabetic and who is considering a hair transplant for baldness on the scalp, they should have blood sugar under control. The parameters which you get investigated by a physician, your physician should say yes for the surgery. The HbA1c should be under control, less than 5.7. And to avoid various problems, various metabolic problems, you need to have a physician on call when you're undergoing a procedure. And the last thing would be that the density of hair should be
Not very high.
Not very high.
HbA1c is not absolutely mandatory to be below 5.7 because even if a patient is a pre-diabetic, 6.5, then also, but it should not be over 8.
Over 8. So
HbA1c.
The physician should say yes to the surgery.
Yes.
Then they can undergo. Thank you so much. It was so enlightening. I'm very hopeful that if you are considering hair transplant as an option and you are diabetic, you will listen to it at least twice, if not more. If you are passionate about understanding your health and want more insights like this, please hit the subscribe button so that you do not miss our future episodes of medical conditions for hair transplant, or rather, hair transplant where medical condition is still existent. Now, another medical problem which is very common nowadays is high blood pressure. We often get to see people are becoming newer and newer patients are turning out to be having high blood pressure
At a younger age. Also.
At a younger age. And suppose we have detected it as a hair doctors for the first time, then maybe he must be having it for a longer period of time.
Absolutely.
So this high blood pressure, if somebody is having, how should we go about for having hair transplant for such a patient?
The first thing is to actually diagnose this at the time of consultation. So as we all know, we have a routine protocol where we are measuring the blood pressure of each and every patient at the time of the first consultation.
Yes.
Rather than doing it on the day of the procedure and postponing or cancelling the surgery, we believe in doing all the screening, and a detailed form is there about their medical problems. And this is first thing we have to identify on the time of the first consultation. We have had patients who are very, very young, 25, 26, and very high blood pressure.
Yes.
We have sometimes diagnosed some rare problems leading to these blood pressure kind of problems. and patient themselves were unaware about this problem. Now, what is blood pressure? Just to clarify what is blood pressure for the sake of everybody out there, blood pressure is the pressure of the blood which is exerted on the blood vessels by the flow of the blood. So if a blood is flowing and the arteries are somewhat hardened, atherosclerotic as we say, or any factor causing some hardening of the blood vessels or increasing the pressure can lead to higher blood pressure. There are values, there are charts of blood pressure. So whenever there is excessive pressure by the heart in pumping that blood to all the organs of the body and through the blood vessels, and if it is on the higher side, this pressure is increased. If we are doing a hair transplant without controlling this, there are multiple risks to that. First is the higher chances of bleeding.
Bleeding at the time of surgery itself.
Pressure is high, the bleeding will be high, difficult to control. The grafts which you are putting will come out.
Yes.
Now, when a person is having a long-standing blood pressure problem, this means the heart is pumping against a lot of resistance for a very, very long time.
True.
And we know that there are two parts of heart, right side and left side. And there are four chambers, right atrium, right ventricle, left atrium, left ventricle. So from the left ventricle, the blood is pumped, oxygenated blood is pumped to each and every organ of the body. If there is a higher blood pressure, that left ventricle is consistently pressing or pumping blood against a higher resistance force of the blood vessels. So this part of the heart can become hypertrophied, which means it can increase in size. Now in hair transplant, we give an injection by the name of adrenaline or epinephrine. This is to minimize or decrease the chances of bleeding. But this epinephrine or adrenaline can sometimes increase the blood pressure. When there is slightly higher blood pressure because of this adrenaline or epinephrine, heart may suddenly be forced into a circumstance where the pressure against which they have to work, the resistance they have to work is very high.
Too high.
And suddenly the heart can go into failure. That is not overwhelmed by that exceedingly high resistance.
Yes.
Left ventricular failure, and this is a medical emergency. First of all, the clinic should be well equipped to deal with this kind of problems, but the best way is to avoid this problem at all. Now, what to do if a person is having this blood pressure? Sometimes there are patients who are continuously taking medicines for this. For blood pressure. Yes. They know that they are having a blood pressure, high blood pressure, and then they keep on taking the medical treatment. The doctor or the clinic, first of all, should find out the details of the medicines they are taking. There are a lot of medicines, whether they are non-specific, beta blocker, specific. I will not go into the detail, but doctor has to know the kind of medicine a patient is taking and the impact that medicine can have on the hair transplant.
Absolutely.
Second thing is that they should get a clearance from the cardiologist. They should do an ECG to see the condition of the left ventricle, the size of that. Better to get an echo also done. If they are okay, then it's not much of an issue. Just controlling your blood pressure and getting a clearance. If it is slightly on the higher side, trying to control it on the day of the procedure, at least 5 to 7 days prior to that, and continuing with the things is okay with you. But if you are taking medicines, then please do not forget to take those medicines on the day of the procedure. That is also again very, very important, because everybody has a white coat hypertension also. People are scared to go to a hospital, doctor or a clinic. That itself can lead to anxiety, and that anxiety can further increase the blood pressure. First of all, the doctor should prescribe you some anxiolytics to decrease the anxiety. And if you have blood pressure, you should keep on taking your medicines. Better to have a consultation with the primary physician or the doctor or the cardiologist. And then if everything is okay, well under control, then you should undergo the procedure. During the procedure, it is the duty of the clinic or the hospital or the doctor where the procedure is performed to keep on monitoring the blood pressure at routine interval. Like at our setup, we have our in-house ECG machine. We have our multi-para monitors which are continuously monitoring the heart rate and the oxygen SpO2 and the blood pressure is measured automatically once every 5 minutes. This is to prevent any such complication which can arise when these things are not being monitored. In fact, we had a patient who had undergone a hair transplant somewhere. His blood pressure shot up very high. They gave a lot of medicines. It came suddenly very down, and it was a medical problem. And then he came to us, and then we performed his surgery after optimizing and doing all the things which we can for
And
him.
all this happened at the start of the procedure only?
There, yeah.
Yes.
Yeah. So these are very crucial things. If you are prepared, then you can very well deal. The doctor can very well deal with the procedure. Also, avoid taking a lot of hot beverages like coffee or tea on the day of the procedure, because this in itself
Coffee
has found
increases blood
coffee
pressure,
increases the
right?
blood pressure. And we had a patient
We
who
had a patient.
was very, very this thing about coffee. He used to take a lot of black coffee, and then his
Yes.
blood pressure increased, and then we took some effort to control it, but not an emergency. But this is something which can happen. So if you are prepared, your journey is going to be smooth. If you are not, it can be troubling, can be problematic. The results will also be compromised, and there can be a sudden emergency in such kind of cases as well.
Yeah, so just to sum up, if you are having a high blood pressure and you are planning hair transplant, after you consult with the hair doctor, you will get to have another consultation with a cardiologist. Maybe you get echo done and you get ECG done, so that any further complications can be prevented. Also, you have to reveal the medicine you are taking, and you have to take your medication on the day of surgery. This is of extremely
Very nice.
important.
Yeah, that's a good summation. Yeah.
Yes, thank you. So in today's series, we have discussed diabetes and hypertension. In the next series, we will deal another two very important medical conditions. We know that hair transplant can be very important for you. Hair loss can be very challenging and disturbing at times. But if you know and understand your medical problem, then it becomes easy for you. It empowers you actually to take the medical condition to stride and opt for a hair transplant, which can increase your confidence and improve your joyfulness and quality of life. So thank you so much for being with us. Stay tuned
for the next episode of medical conditions and hair transplant.
Thank you. If you found this video useful, share it with someone who would get benefit from it. If you want to find your hair loss grade, please click the video on the left. And for ultimate hair transplant step-by-step guide, please click the video on the right. Thank you.